Treatment and services under EPSDT. EPSDT, or Early and Periodic Screening, Diagnostic, and Treatment, is part of the Medicaid Act and entitles children under the age of 21 to all services that are medically necessary to make or keep them physically and mentally healthy. The goal of EPSDT is to make sure children get the health care they need when they need it in order to treat or prevent health problems as early as possible. In this video, we will cover why EPSDT has certain requirements that must be met for a service or treatment to be covered. Treatment and services must be medically necessary, fit within a recognized Medicaid service category, be prescribed and provided by a Medicaid provider or physician. What does medically necessary mean? A service is medically necessary when it corrects or ameliorates a condition. A treatment or service ameliorates a condition if it does one or more of the following: addresses or improves the condition, maintains the condition, prevents a health problem from getting worse, or prevents new problems from developing. The determination of whether a service is medically necessary is made on a case-by-case basis as children have their own particular needs. Even if a condition exists before the child starts to receive Medicaid, it must be covered if medically necessary. Who is defined as a provider? A provider can be used to mean doctor, therapist, personal care assistant, or any other person that provides services that are paid for by Medicaid. Who decides what is medically necessary? Your child's provider will document the need for service or treatment and be able to show that the service is medically necessary. This recommendation will include the type of service, for example, therapy, the amount, how much of the service, and duration, for how long the service will be provided. Deference is given to the provider's recommendations for your child's needs. This means their opinion is to be given respect and weight. What treatment or services are available under EPSDT? The Medicaid Act includes mandatory services, which Iowa must provide, and optional services, which Iowa may provide. Any service that is available through Medicaid must be available through EPSDT for children when medically necessary. This includes some services that may not be available to adults. Examples of the scope of services available under EPSDT include mental and behavioral health services, inpatient and outpatient hospital services, physician services, dental services, home health care, private duty nursing, physical and occupational therapy, speech, language, and hearing services, durable medical equipment, care coordination or case management services. A request for EPSDT service or equipment only needs to fall within the scope of a service that is on the list to be covered. For example, neither autism services, such as applied behavioral analysis, nor equine therapy are listed in the Act. However, both can be covered under EPSDT because they fall within the scope of at least one of the service categories listed in the Act. EPSDT also requires Iowa to cover transportation to and from medical appointments. It may even cover out-of-state travel, lodging, and meals if the travel is medically necessary. There is no copayment or other cost to a family for services covered by EPSDT. There is no waiting list for EPSDT services. Iowa should not place hard limits on services that are medically necessary. How do you request services? A child's physician, therapist, or other Medicaid provider will help you get the services they need. They will submit a request for treatment or equipment. If a child is enrolled in a Medicaid managed care plan, the provider will contact the Managed Care Organization, or MCO, to request the treatment or service. If a child is not enrolled in a managed care plan, the provider will submit the request to Iowa Medicaid. You do not have to say you are requesting EPSDT services. However, if you are having trouble getting your provider to prescribe a service your child needs, or if your request to have a service covered is denied, it may help to mention that EPSDT requires that children receive all services that are necessary in a timely manner. For more information on EPSDT and other information, visit our website at www.driowa.org or call Disability Rights Iowa 515 278 2502.